Hi, my name is Madeliyn Hoffer. I'm with Leadership Initiatives. What's your name?
Hello, I'm Dr. Hamza Yusuf, and I'm going to be your guide. So you can go ahead and ask your patient all the questions you want. Okay.
Okay. Hi, what's your name? How are you doing today?
Hi, Miss Sudanshi. The current now. Okay, he said his name is Abdullahi Ibrahim Sulaiman, and he's 7 years old.
Okay. So tell me more about how you're feeling. How,
Wai ya yake ji? Yake da. Ke wannan wanda ya fara yaushe ya fara. Okay. He's been having these abdominal pains that has been recurrent for over a year now. However, the recent episode started about 1 week ago.
okay.
Yeah.
Um, are you experiencing any fever?
Akwai zazzaɓi? Okay, there's no fever.
No fever. Any coughing?
Akwai tari? There's no cough.
Okay. And do you have any gastrointestinal symptoms like constipation, diarrhea?
Okay, wai akwai gudawa ne ko kuma amai ko na abu? Mm. Okay, there's no constipation or diarrhea, but he occasionally has some postprandial vomiting.
Okay. Um, And have you noticed any yellowing of the eyes or palish skin?
Wai akwai idan shi yana yellow ne ko kuma jikin shi haka? Eh? Okay, okay, yes, he has some yellowness of the eyes.
Okay. Um,
Mm.
and have you been feeling fatigued, tired lately?
Wai yana jin mutuwan jiki ne? Eh? Okay, 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 yes, he has some low energy and fatigue.
Okay, and with that, does the fatigue go away with rest, or are you always tired?
Wai idan ya huta yana gajiya ko idan ya huta kin gane yana abin yana tafiya ko kuma ko da yaushe yana nan. A'a, wannan gajiyan. Okay. Okay, it actually doesn't get relieved by rest. So all
Okay,
the time, yeah.
time. Have your nails been brittle lately, like easily breakable?
Wai kaman farcocin shi haka wani lokaci suna yawan karyewa ne ko na abu? Eh, not in particular.
Hmm?
Not really.
Not
His
really?
nails have been like that all through.
Okay. Um, and let's see.
Do you want to know how their home is, how their setup is, how they live? Do you want them to say something about it?
What'd you say?
Do you want them to tell you something about how they live, if they have any stagnant body of water around them or something?
Oh, yeah. So is there any stagnant water around your house, and who do you live with?
Wai gidanku akwai irin kamar inda ruwa baya akwai irin ruwa wanda ko rijiya ko nawu babu akwai ciyawa a gefen gidan. Okay. Okay. They actually don't have any body of stagnant water in their home, but their house is actually surrounded with some bushes.
Okay.
Yes.
Um, so did I already ask if you've had a headache lately?
ciwon kai ne? Yes, he actually has a headache.
Okay, and on a scale of 1 to 10, what would you rate the headache?
Wai wannan ciwon kan a ko da yaushe yana nan ne ko kuma a misali in kika ce daga 1 zuwa 10 makin da za a ba wa ciwon kai kenan. Okay. She'll give it a 5.
5?
Yeah.
Okay. Um,
You like us to tell you the temperature of the patient?
hmm?
Do you want us to tell you the temperature of the patient or some of
Oh,
the
yeah,
vital signs that we took?
yeah. So
Okay.
yeah.
Okay. We actually did the temperature of the patient
Hmm.
and it was 38 degrees Celsius, and which is indicative of fever, even though the patient did not complain of fever, but on examination, we found out that the patient actually has a fever. And in addition, we did the pulse rate and it was 120 beats per minute, which is high.
Okay.
The respiratory rate is within normal limit.
You said the respiratory is normal?
Yes, it's normal.
Okay.
So, yes. So, would you like to order for some investigations?
Yeah, I'd like to do I'd like to see the blood culture results if you have them.
Okay, great. We took samples for the blood culture, but it will be out in the next 72 hours.
Okay.
So, but we did a but we actually did a wider test for typhoid fever, which
Mm-hmm.
turned out positive.
Positive. Okay.
Yeah,
And
positive.
do you have the hemoglobin levels at all?
Yes, we do. We did a complete blood count,
Okay.
and the hemoglobin level is actually 10 grams per deciliter.
10? Okay.
Yeah,
So
10.
that would be mild anemia then. Um, so for that, I'd recommend some oral iron supplements, and for the typhoid, some antibiotics, and for the fever, some antipyretics, just to help lower that. Um, so that's for those two.
Okay, great. Wai tana tunanin za a ɗan bashi maganin typhoid fever, antibiotics, sannan za a ɗan bashi paracetamol saboda ya rage zazzaɓi, ko? Sannan kuma za a ɗan bashi iron tablets saboda kamar jinin shi a ɗan sauka ƙasa kaɗan, ko? Yeah. So I've actually explained what you said to your patient.
Okay.
I don't know, is there any other thing else you'd like to tell your patient?
Um, I think that's all actually.
Would you like to tell them something about prevention of typhoid fever so that
Prevention? Oh yeah.
also, yeah,
Okay, so for preventing getting typhoid again, I just recommend making sure the food you eat is clean. So like trying to wash your hands, um, because that one is spread by consuming fecal matter, um, if the food is dirty.
okay. Wai tana so ta gaya muku yadda za ku kare kanku daga typhoid daga a nan gaba, sai da kuna wanke hannu sosai saboda daga yes, musamman idan an shiga bayi an fito ana wanke hannu ko saboda idan an wanke hannu shine yawanci yadda ake ke yaduwa saboda a shiga ban ɗaki ba a wanke hannu ba shine ke yaduwa. Yeah. So I've explained everything you said to your patient, and they have actually heeded your advice, and they're also grateful for all that you're doing for them. Just to add that, you can also tell them to make sure they take portable water,
Okay.
sanitize their water. You should always, if they cannot afford table water, they can always boil their water. Okay,
Hmm.
and yeah, and also they should also um, make sure that if they're going to have and they don't patronize local food vendors that they are not sure of the hygiene and what have you.
Okay.
But yeah, so if there's nothing else you like to your patient, I think you can wave your patient goodbye and we can have a nice day.
Okay. Bye.
So,
Have a nice day.
tutashika mata bye bye. Tena muku bye bye.